Hi guys!
Welcome to the story of Diagenesis.
What is diabetes? Diabetes is a chronic endocrine condition that affects the body's ability to process sugar. There are two main types of diabetes, type 1 and type 2. Both types share a defining characteristic, which is the dangerous buildup of sugar in the bloodstream. In humans, the blood glucose target range is 70 to 100 milligrams per deciliter. Blood glucose targets should be in a healthy range to prevent diabetes complications. Diabetes can occur because one's pancreas either fails to produce insulin, not enough insulin, or the insulin produced does not work properly. Diabetes mellitus type 1 is a chronic disease where the pancreas produces little or no insulin. Type 2 diabetes occurs when the body becomes resistant to the effects of the insulin hormone. The fundamental issue of diabetes is the lack of or resistance to insulin production. Insulin is an amino acid whose role is to metabolize ingested sugar into either immediately usable energy in the form of diabetes affects the ability to produce this protein as well as the metabolic activeness of the insulin produced. When the body does not produce enough or becomes resistant to insulin, sugar builds up in the bloodstream. Without treatment, it results in a state of high blood sugar called hyperglycemia. Hyperglycemia can affect the body by causing an increase in thirst and urination, unnatural hunger, blurred vision, fatigue, and emotional irritability. Untreated diabetes can also cause rapid weight loss as the body is unable to store ingested energy as fat. The long-term effects of diabetes includes one of the most common chronic yeast infections, heart attacks, kidney failure, blindness, and nerve damage in both the hands and the feet. Diabetes also affects the type of diet an individual can consume on a daily basis. It is important that both type 1 and type 2 diabetics maintain diets that are low in carbohydrates and high in proteins and vegetables. To diagnose any type of diabetes, a blood test can be performed. This test measures the level of sugar present in blood and can be performed after a fast or normal eating schedule. For diabetics, type 1 diabetics don't produce any insulin and must administer daily insulin shots to process their food. Type 2 diabetic insulin have become resistant and must manage their condition with proper diet and exercise. Medication may also be necessary depending upon the severity of their condition.
Blood glucose test by a Diascan machine. So we have gloves to put on for universal precaution. Then our strip, our meter. Make sure that the strips are up to date. It's not expired. It has to be sealed properly. Our machine, put it on. It's working. No, it's calibrated. Make sure that the battery is not going on it. You're not seeing the symbol. Ensure that it's working properly. And then we have our lancets that we use as a finger stick, and also cotton swabs that we would use, right? So these are the material. So we'll introduce ourselves. I'm Ms. Hossain Ali. What's your name? Sharda. So Sharda, what we'll be going to do today is basically a blood glucose test using the finger stick method. When last did you have something to eat? Last night. So this would be a fasting blood glucose level using the Diascan machine. So we open, we retrieve one of the testing sticks. Remember, you close immediately after. It has to be kept in an airtight container. You put on the monitor. When you put on the monitor, the strip has a particular direction it has to go. So you insert gently. You wait, this is the code that will come up, after which you'd see now it's ready to be for the blood to be inserted. So which finger? We normally use the non-dominant hand, and we inspect the finger. The finger must not have any hard calluses, any bruising or anything. So we clean the area, and I tend to massage the finger a little to get the blood flow. Basically, we're going to stick perpendicular to get a blood flow. So we're using a one-touch lancet. You go down, that's it. We squeeze, and this machine requires very little. Here we go. So we hold this, apply pressure, and our result is up already. Please know that we are discarding the sharps in a sharps container. Alright, so her result, 83 milligrams per deciliter. mg/dl means milligrams per deciliter. So that's under the normal ranges for her. So basically, that is how we do a finger stick for blood glucose.
Glucose tolerance test is a medical test in which glucose is given and blood and urine samples are taken afterwards to determine how quickly this glucose is cleared from the blood. The test is usually used to test for diabetes and insulin resistance. Prior to this test, this patient must have dated. This means that they should not have eaten or drunk anything besides water. 3 samples are taken within a 2-hour period. The patient is not allowed to drink or eat anything else besides water. The first blood and urine sample is taken. Approximately 3 ml of blood is taken for each sample. This sample would be called the fasting glucose and should be between the range of 70 mg per deciliter and 110 mg per deciliter. The patient is then instructed to drink a glass of 75 mg of glucose solution. The patient is sent to wait for 1 hour. The collecting tubes are pre-packaged with fluoride and potassium oxalate in order to prevent the glucose from burning during the blood analysis. The tube is then inverted at least 12 times in order to mix these substances. After 1 hour, the second blood and urine sample is drawn. This sample is called the 1-hour OGTT glucose level. This value should be less than 200 mg per deciliter. The patient is required to wait for a further hour. After 1 hour, the third and final blood and urine sample is taken. The sample is called the 2-hour OGTT glucose level. This reading should be under 140 mg per deciliter in order to be classified to have a normal glucose tolerance.
Treatment for diabetes. How is diabetes treated? Considerable efforts have been made since the 1950s to better understand the cellular and molecular mechanisms of the action of metformin. This is a potent anti-hyperglycemic agent that is now recommended as an oral therapy for type 2 diabetes. The main effect of this drug from the biguanide family is to acutely decrease hepatic glucose production, mostly through a mild and temporary inhibition of the mitochondrial respiratory chain complex 1. In addition, the resulting decrease in hepatic energy status activates the activated protein kinase, AMPK, a cellular metabolic sensor providing a generally accepted mechanism for metformin action on hepatic gluconeogenic program. Beyond its effect on glucose metabolism, metformin was reported to restore ovarian function in polycystic ovary syndrome, reduce fatty liver, and to lower microvascular and macrovascular complications associated with type 2 diabetes. Its use was also recently suggested as a secondary treatment for cancer or gestational diabetes and for the prevention in pre-diabetic populations. Prevalence of type 2 diabetes has reached epidemic proportions worldwide and increases the risk for cardiovascular diseases and early mortality. The most widely prescribed drug to treat hyperglycemia in individuals with type 2 diabetes, metformin 1,1-dimethylbiguanide, a biguanide derivative, is recommended to be used in conjugation with lifestyle modifications such as weight control, diet improvement, and physical activity. Recent clinical trials suggest that metformin, in addition to its efficiency in treating type 2 diabetes, may also have therapeutic potential in other conditions, including diabetic nephropathy, cardiovascular diseases, polycystic ovary disease, and the prevention or treatment of cancer. Metformin is currently the drug of first choice for the treatment of type 2 diabetes, being prescribed to at least 120 million people worldwide. It is regarded as an anti-hypoglycemic agent because it lowers blood glucose concentrations in type 2 diabetes without causing overt hypoglycemia. Metformin is also frequently described as an insulin sensitizer, leading to reduction in insulin resistance and significant reduction of plasma fasting insulin levels. The improvement in insulin sensitivity by metformin could be ascribed to its positive effects on insulin receptor expression and tyrosine kinase activity. The primary function of metformin is to decrease hepatic glucose production, mainly by inhibiting gluconeogenesis. Several mechanisms have been proposed to explain this inhibitory action on hepatic gluconeogenesis, including changes in enzyme activities or reduction in hepatic uptake of gluconeogenic substrates. The preferential action of metformin in hepatocytes is due to the predominant expression of organic cation transporter 1, OCT1, which has been shown to facilitate cellular uptake of metformin. AMPK is a heterotrimeric protein consisting of a catalytic alpha subunit and two regulatory subunits, beta and gamma. Each subunit has at least two isoforms. AMPK is activated by the increase in the intracellular AMP on ATP ratio, resulting from imbalances between ATP production and consumption. Activation of AMPK involves AMP binding to regulatory sites on the gamma subunit. This causes conformational changes that allosterically activate the enzyme and inhibit this dephosphorylation. Activated AMPK switches cells from an anabolic to a catabolic state, shutting down the ATP-consuming synthetic pathways and restoring energy balance. As a result, glucose, lipid, and protein synthesis, as well as cell growth, are inhibited, whereas fatty acid oxidation and glucose uptake are stimulated. Metformin most likely does not directly activate either LKB1 or AMPK, as the drug does not influence the phosphorylation of AMPK by LKB1 in cell-free assay. Understanding the mechanism of action of metformin establishes that both LKB1 and AMPK activities are dispensable for metformin-induced inhibition of gluconeogenesis. The rate of hepatic glucose production is closely linked to hepatic energy metabolism. Therefore, disruption of the main energy supply in hepatocytes through inhibition of the respiratory chain complex 1 would have a profound effect on the flux through gluconeogenesis. In addition, as AMP tends to rise whenever ATP falls, this could also provide an alternative explanation for the acute inhibition of gluconeogenesis by metformin via allosteric regulation of key enzymes in this pathway, such as fructose 1,6-bisphosphatase. In addition to the suppression of endogenous glucose production, metformin has been shown to be beneficial in improving lipid metabolism. Metformin-induced reduction in hepatic lipid content is consistent with an increase in both fatty acid oxidation and inhibition of lipogenesis, presumably mediated by AMPK activation. AMPK activation by metformin induces the phosphorylation and inactivation of acetyl-CoA carboxylase, ACC, an important rate-controlling enzyme for the synthesis of malonyl-CoA, which is both a critical precursor for the biosynthesis of fatty acids and a potent inhibitor of mitochondrial fatty acid oxidation. In humans, metformin enhances ACC phosphorylation and induces the reduction on triglycerides levels. AMPK suppresses expression of lipogenic genes such as fatty acid synthase and ACC by direct phosphorylation of transcription factors. Fatty liver disease is strongly associated with insulin resistance, and the apparent inhibition of hepatic glucose production by metformin may be secondary to the primary improvement of hepatic steatosis and insulin resistance. The polycystic ovary syndrome, PCOS, is a common endocrinopathy affecting at least 5 to 15% of reproductive aged women. It is recognized that insulin resistance is a common feature in PCOS. As a consequence, insulin sensitizers have been proposed as a pharmaceutical option in women with PCOS and insulin resistance. Metformin treatment may increase ovulation and improve menstrual cyclicity. These beneficial effects of metformin are based on alleviation of insulin excess, acting upon ovary and through direct ovarian effect. Insulin was shown to directly stimulate several steroidogenic enzymes in the ovary, such as CYP17, by improving insulin sensitivity. Metformin reduces CYP17 activity.